welcome to this segment of Dr. TN3. I'm Dr. Terry McCoskey. Today we're going to talk about different technique systems in chiropractic. And in the last count there were over 250 different names of systems or ideas or techniques, if you will, to move the spinal column. All chiropractic is going to focus on spinal care because that's where the nerve system is that runs your body. And the ideal situation for you may not be the same as it is for me or for somebody else. The technique system that we use in this office is known as NUCCA. NUCCA is an acrostic or an acronym, if you will, for the National Upper Cervical Chiropractic Association. The thing that attracted me to the NUCCA system is that it is in fact a system. It's based on measurement, which means it's predictable, it means it's reproducible, and it means that the outcomes can be demonstrated repeatedly over time. So what I really enjoy is taking measurements of a patient or a person first, saying here's where you are, here's where you should be, oh and by the way, are we there yet? So with corrective care, we're going to measurably and predictably reproduce an adjustment for that person when necessary that lets their spinal column come to rest in a normal balanced place, and then gives that nerve system a happier place to run their life. Bottom line, if you sat out in the front room here in our reception space, we like to call it the lounge, actually, it's kind of a lounge. And if you just listen to people chatter all day long, what you would hear are stories about my child didn't need tubes in their ears after their NUCCA care, or my asthma is better, or my thyroid chemistry is improving. My other healthcare providers are documenting for me the changes that are taking place in my body with the NUCCA adjustment. It's a gentle adjustment, which means whether you're 2 years old or 102 years old, if you can lay on your side, the adjustment requires about as much pressure as it would take to check your own pulse. So it's a very gentle way to receive corrective, predictable, and reproducible results in a spinal care setting here at Living Well Spine Center. So when you listen to people talk about their results, you will hear people describing changes in their digestive system, changes in their sleep at night. And people may come here with low back pain or radiating hip pain or leg pain. The focus of the NUCCA adjustment will always be the upper cervical part of the spine. All the information that gets out of your brain and into your body has to pass through this gate. If the atlas or the top bone is misaligned in relationship to the head and the neck, then it's changing the way information is processed. The results are going to be symptoms that blow all through the system. It's not the symptoms just tell us there's a problem. It is usually assessing the upper cervical spine that reveals that's where the problem has begun. So correcting the upper cervical spine means we're actually addressing the cause of most people's issues, and we've got a very high percentage of helping the people that show up here with that method. So the NUCCA adjustment, predictable, reproducible, measurable, and the goal is balance the body at a stable place in a gravity-based environment, and then teach you how to take care of it for the rest of your life so you need us less. Have a great day.